Medication-related errors are one of the most frequent causes of preventable harm in healthcare, and they're the single most common reason a doctor seeks advice from their indemnity provider. The prescribing process is complex, with many possible stages of care where errors can be made. But thanks to ongoing global safety efforts, the biggest remaining threat to patient safety is now human factors, not technical failures. Human error can't be eliminated, so it's vital that we're continuously examining our prescribing processes to ask ourselves if we're doing enough to minimize it. I chose to make this video after an error I unfortunately made in calculating the patient's dose of a liquid medicine. Our investigation of this error highlighted some key safety issues with liquid medicine specifically, and allowed better systems to be developed to reduce this risk in other aspects of our prescribing processes. Realizing that you've made a prescribing error is deeply unsettling, but if these incidents can improve our practice overall to help other patients at your surgery, then this can both help on a personal level to process what's happened and ensure positive changes are introduced to your practice to help your colleagues too. So we'll first take a look at responding to a safety incident, then strategies to improve safety after that. The most important step after a safety incident's identified is informing the people who've been affected by it, so appropriate actions can be taken to keep that person safe and ensure that any harm they may have suffered has been managed appropriately. This is called the duty of candour, and there's lots of resources offering advice and guidance on how we can fulfill this duty. But my favourite resource was made by the Medical Defence Union, so I would recommend familiarising yourself with this guidance now so you know what needs to be done when an incident's identified. After these immediate actions have ensured the patient's safe, we can start examining the causes of our error so we can design better processes to prevent similar errors in the future. When we're talking about safety, the best industry to learn from is aviation, as much of the learning from this sector has already been incorporated into our practice. The aviation safety website Skybrary has articles on over 70 different human behaviours that can increase the risk of a safety incident, but they call the most commonly implicated behaviours the filthy 15. In busy healthcare organisations, we're often put in positions where we're exposed to all of these factors. It's so important we take steps to minimise their impact to keep patients safe. Involving a second person is one of the best steps you can take to improve safety, and the effective team of a pilot and co-pilot in aviation is a perfect example of this in action. Looking at the filthy 15, a good relationship between a pilot and co-pilot can minimise the risk of the majority of these behaviours. It might initially come as a shock, but a pilot will make at least one error on 80% of commercial flights, and the rate of error falls somewhere between 1 and 5 errors per flight. But this is okay because the error is generally identified and corrected by the cross-checking process completed by the co-pilot. So for every prescription we write, the key question we need to have in mind is, who's my co-pilot? For the vast majority of scenarios in primary care, your co-pilot will be the community pharmacist who will check your prescription before dispensing it. These are highly skilled healthcare professionals, but at the time of filming, their access to information is very limited, and they're reliant on our communication to make an informed review of the prescription. We now have excellent tools to communicate with pharmacies, as through Accurix we can share additional background information to help the community pharmacist assess the prescription. All pharmacies in the UK have a standardised address format for their email, which uses the F code you'll see at the bottom of the med screen. The address is always pharmacy.fcode@nhs.net. This creates a secure dialogue between the practice and the pharmacy, allowing you to share relevant information to help the pharmacist assess your prescription. But your region may already have even better ways to share this through NHS Digital's GP Connect rollout. You may feel the best co-pilot for the task at hand is another member of the practice team. We're used to checking each other's work routinely, but for this we may need to take extra steps to ensure the right level of scrutiny is applied. At our surgery, we're now ensuring this through an agreed process for a second check. By asking, "Can I get a second check?" the co-pilot will not just check the final prescription, they'll go back to the start of the job and work through each step individually to see if they reach the same conclusion. This naturally takes a little longer, but the analogy I like to use to illustrate the value of this is the brief delay before crossing the road. It's much faster to pelt out into the road without looking, but we all know that briefly pausing to look both ways makes a lot more sense in the long run. See you next time.